Now, when you come to children, there are 2 studies that have shown that children exposed to radiation have a 1 in 10,000 chance of getting leukemia or a solid tumor somewhere in the body. But there the WHO has come around and said that we don't know whether this was reverse causation. That means, was the CT scan done because the patient was symptomatic, but the tumor had not yet manifested in the body, and in later, a year or 2 later, the tumor showed up. So the tumor was already there, not caused by the CT, etc. Because you have to eliminate reverse causation. I mean, somebody doesn't get a CT scan done for time pass, no? There is a symptom, you have a headache, you have something. This is all about CT brain. Something is there, therefore you've gone to get a CT done. And then you develop a tumor. What if the tumor was already there and you didn't know about it? But even if you leave that out, even if, as we say, okay, children are a little more sensitive to radiation and perhaps them we have to be careful. It's 1 in 10,000 people who receive radiation that you have an increased incidence of cancer. It's ridiculously low. So in adults, it doesn't matter. One more thing, and this I sometimes have to tell helicopter daughters especially and children. You know what helicopter children are, right? Constantly hovering around their children or their parents, right? So let's say you have a 70-year-old who requires a CT scan. So the child, the son, daughter, son-in-law, somebody will come and say, "Are pan emne radiation thase, pachi su thase." So even if you assume for a moment that radiation produces cancer, the effect of that mutation is 20 years. So if you already have a CA lung and you need to get a PET CT done every 3 months, you're not going to live 20 years, no, to get another cancer. I mean, come on, yeah. So you need to explain all this. It was so bad, there was a CEO of a bank, a lady who had CA breast, metastatic, who only used to get whole body MRIs done because she believed that radiation produces risk. Now, metastatic CA breast, the best case you're going to live for 6 to 7 years more. And we couldn't get it into her head. Educated, ran for Lok Sabha elections, all of that, but we couldn't make her understand that, you are not going to die of radiation, until finally I had to tell her on her face, and then she agreed, and then she started getting PET CTs done. But this is the long and short of it. So I would say, to summarize, in adults, there is no proof or data in 128 years, which is a very long period of time, that radiation produces increased cancer risk from any diagnostic imaging, including cath angios, etc. In children, there may be a possibility, we still don't know. There is no harm being a little more careful in children and not doing unnecessary testing. If the test is required, it has to be done. So, sorry, long answer, but I think it's important to be understanding.
Absolutely.